feel a pulse with compressions.
Yes.
Twenty-seven, 28, 29, 30.
And there is a pulse.
There is a pulse. Okay, stop CPR. We're at 37. Looks like maybe block. Okay, so we are now over there. Are they breathing?
No, they're not.
Okay, so we're going to continue with that. ECG if we can.
Okay.
Here, I can do that. Okay.
We're going to start the leads, the cardiac leads. Take a blood sugar while we're here, why not? Still has a pulse.
Yes.
Okay, and then we're going to pace. Okay. At 70, we're getting the pacing, so I'll go up to 80. And I'm gonna feel a pulse.
There is a pulse.
Perfect. Gonna do a set of vitals.
Mm-hmm.